So oftentimes patients will first approach their family doctor and then get referred to a cardiologist in the community and then get brought to us to have a discussion about surgery. And we want that whole process to be seamless. A lot of communication back and forth so everyone really knows what's going on. The initial consultation is going to be about getting information from the patient and then also giving information. Some people come and say, I have read all this information on the internet and I'd like to discuss with you these 5 options. That's okay, and we can do that. Some patients come in and say, Doc, I'm so scared, you do what you want. You just tell me what the best thing is, you have all the information. I tend to be like that when something needs to be fixed on my house. I just leave it up to the experts with some degree of input. So I find that patients, they vary into how much input they want to have and how much they want to know. For me, heart valves are like doors. They open and they close. There's 4 valves in the heart. And sometimes they don't open very well, and sometimes they don't close very well. And that's put a lot of pressure on the heart. That's essentially it. When it gets real bad, we take the valve out and we replace it with a prosthetic valve, or sometimes we repair the valve. And we walk the patient through that, what they can experience in that journey.
We normally go to the patients with a recommendation, which is for sure not a way to impose anything to patients, but to suggest what the consensus identifies as the best potential option for that patient. But I find it that it's obviously key to have a truly engaged patient. First of all, because undergoing any kind of treatment, even if it's a minimally invasive surgical treatment, is still quite a journey for patients. So I think they need to be mentally and physically completely committed and into the journey as very active players. And for many patients, the journey continues because their treatment may require, in some cases, to significantly change their lifestyle, which means that they need also to understand that their problem doesn't really is not simply taken care of with the surgery, but requires their continuous commitment in changing their lifestyle and improving some of their habits so that the benefits of the treatment can be carried on over time.
It doesn't just stop at the procedure. There's post-operative care that needs to be discussed and arranged. We continue to see patients for, an extended period of time, sometimes after their procedures. So, and we're open and happy to do that because that's what we're here for.
At the end of the day, though, we try and get a sense of what's best for that patient and what's best for their family, what their goals in life are, and try to meld that with what's best clinically and find the best thing for the patient. We're advocates for our patients at the end of the day.